In the last video, we discussed diabetes and mentioned that we would be making at least one more video about diabetes. We're going to break it down to short-term complications and long-term complications. So subscribe so you don't miss it. In this video, we're going to discuss the short-term complications and the acute problems. Hypoglycemia is low blood sugar. Since the body can't control its sugar on its own, then there's a risk that the blood sugar can go too low. This is extremely dangerous, and symptoms include shakiness, anxiety, sweating, chills, pallor, confusion, a high heart rate, nausea, hunger, lightheadedness, and unconsciousness. Obviously, this is very dangerous, and if the sugar drops too low and isn't treated, the person will likely die. If the person is awake, they can drink a sugary drink like juice to bring their sugar levels up, and then having a protein snack associated with it can keep the levels up. The protein prevents the sugar from climbing and then dropping again. Hyperglycemia is high blood sugar, and it can be just as dangerous as low blood sugar. But there's a wider window, so it can often take longer to become deadly. This can occur when people are not monitoring their blood sugar often enough or not eating the proper food. Early symptoms include frequent urination, increased thirst, blurred vision, fatigue, and headaches. Later and more severe symptoms include a fruity smelling breath, nausea and vomiting, shortness of breath, dry mouth, weakness, confusion, and eventual coma. Diabetic ketoacidosis occurs when somebody's hyperglycemic for a very long time and isn't actually treated. This occurs when the body begins to break down fat as fuel. This creates a high level of acid and ketones in the bloodstream. Ketones smell very fruity. This causes the fruity smelling breath and is actually a classic symptom of high blood sugar. This will drop the pH of the body, making it more acidic. At this point, the body will make changes to try to compensate and change the pH back to a normal level. Breathing will increase to try to remove as much carbon dioxide as possible, as carbon dioxide is acidic. Nausea and vomiting will occur, again to remove acid from the body, the stomach acid in particular, and urine production will increase to remove excess sugar from the body. The kidneys will work to excrete sugar from the body by putting sugar in urine. Unfortunately, this won't be enough to actually fully combat the pH, and not only that, these actions have other complications on the body. Because of vomiting and excess urination, the body will become dehydrated and electrolytes will become imbalanced. If untreated, the body would eventually go into a coma and then the person would die. Luckily, it's quite treatable. The treatments in order of importance usually include fluid resuscitation, then the reversal of the acidosis and ketosis, reduce glucose levels to normal, replenish any electrolyte imbalances. Lastly, we would identify any cause of the diabetic ketoacidosis and treat if needed. In the next video, we're going to discuss long-term complications of diabetes, so subscribe so you don't miss out on any future videos. Like and comment too. If you have any questions, leave them in the comments, and we'll reply to your comments answering any questions that you might have. Thanks for watching, and have a great day.